Welcome, I'm Dr. Gohl, and I just presented to you the difference between nerve interference and heat readings that can be detected by the delta T instrumentation. Now I want to explain to you my approach to chiropractic and to your health. First of all, when we're born to be self-maintained. In other words, when you nurse from your mother, you're not concerned about the heart, the liver, the gallbladder. You just do a natural process. Then the body takes that milk and converts it into living structures. And the way that it does that is through the use of the organs that are placed in our body. And the nervous system is what controls that. Most of our patients come in because they have a backache or a stiff neck. However, they're not concerned so much, usually, with systemic problems, but that's what is caused from the interference to the nerve. So what I want to do now is to demonstrate to you the information we showed that occurred in your spine and how it affects it if we correct it through a series of slides. These pictures are taken from two x-rays from a young fellow in his early 20s, and he was living with some chiropractors that were living with some students who were going to chiropractic college. And he was in an automobile accident. He ends up with 2 broken wrists and 2 compound fractures in the upper arms. When he got out of the hospital, he couldn't walk. So they brought him over to my office. I have classes every once a week, and we stood him up and took this picture on the left, and it shows that the sacrum is pushing against the 5th lumbar. Normally we would consider that people, when they talk to the orthopedic surgeon, they say, well, you have a ruptured disc. Well, the disc normally can't rupture. It can degenerate, but it won't rupture by a trauma. So it shows that the sacrum is pushing against the 5th lumbar, and it's altered the curve in the lumbar, and it's actually reversed the curve in the cervicals. We take a comparative x-ray after 10 visits, and the second picture shows that the disc went back to its normal position when we replaced the sacrum in its normal position. And then the curves came back on their own. These are the x-rays of that patient. And you can see where they had fixed his wrist up and the screws in his upper arms. And we described what we just talked to you about. You can see that the lumbar curve has been reduced in the left picture. In the right picture, when we restored the sacrum to its normal position, it came back normal as well as the cervical curves. We're not concerned with the body changing structures. We're just concerned that we took pressure off the nerves. This patient came to me. He's had puffy eyes for years, but you can see in that left eye, the fluid got so bad in that eye that it affected the ability of the eyes to focus normally. So when we found a pressure in the back of his neck, we adjusted it. And you could see that now, when we took the pressure off the nerve, the left eye drained, and he could focus his eyes, and the headaches went away. This is a picture of a regular patient of mine. He wakes up in the morning with Bell's palsy, trifacial neuralgia. And when we found the cause and adjusted it, then we took a picture the next day. This is a picture taken the next day. And because he responded so quickly, because it only occurred for a short period of time, therefore there was no extended pathology. This patient came to me with, she's had a heart condition on and off for the past 17 years. She came here with her husband from South Africa to go to chiropractic college. While she was in college, she had a recurrence, and what was happening, the heart could not pump the fluids throughout, so it accumulated in the abdomen and also in the legs. You can see also that how drawn around her neck and black under her eyes. So we did the same thing with her that we did for you. We checked her back and we found areas where there was a nerve interference. We don't know exactly where those nerves are going to go, and we don't know exactly what will happen after we remove the interference. Now, in her case, if the valves had been destroyed and couldn't hold back the blood, then she would not be a chiropractic patient. She would have to have an operation. But we don't know that. So what we do is then we remove the interference. So she didn't change much in the first week and a half. She started to eat a little better, and she started to sleep some. But in the third week, she lost 70 pounds of fluid. We took this picture about a month and a half later. And what happened, there was nothing wrong with the heart. It just wasn't getting its proper nerve supply, so it couldn't pump the fluids out. And because of that, there was no pathology in her. And so when the fluids were extracted to the kidneys, she had no symptoms. She had no residual symptoms from removing that condition, and it never returned. And when he graduated, they went to New England to practice. This is a little different. It comes from a 10-year-old girl. I have a patient that was a teacher in Glendale. She came in one day and I said, "How are you doing?" She said, "I'm doing fine, but a terrible thing is happening to one of my students. She's in Children's Hospital with terminal leukemia. She's been in there for 5 months. They've been giving her chemotherapy 3 times a week, but she's not responding, and they're stopping giving her. They don't expect her to live." So I said if they would bring her in, I just wanted to take a picture to see what we could find. So we stood her up. We took this picture, and it shows she's lost all the curves in the cervical. So after we adjusted her, after 10 visits, we took another picture. And this is the post x-ray. What was happening, there was pressure placed upon the cord at the level where it was supplying the function of the reproduction of the white cells in the body. They were reproduced, but they wouldn't shut off because the mechanics had been interfered with, so they were keep requiring reproduction of more and more cells. So when we removed the interference, it stopped this process. This is the before and the after picture. After about 4 weeks, she got well enough to when we shot this picture, she was back in school again. This is a little 10-year-old girl. She came to me. She was a daughter of a chiropractor in Santa Monica. She kept having trouble in her right hip. So they went over to the laboratory in Glendale here, and they took this diagnostic film, and they diagnosed her as having leg Perthes disease, which is caused by a blockage of the nerve supply to the leg. What they wanted to do was to have her go to the orthopedic surgeon. They would put a steel brace on from the hip down to take all the pressure off that joint, and she would have to wear it for 18 months. After that, the condition would resolve itself because there's no longer any growth in that leg. So what we said for her to do, we will remove the interference on the ilium so that the blood supply can be restored to that leg. And all you have to do is try to keep as much pressure off that leg as you can. Just get a set of crutches, and then we will check and see the progress of what happens after we remove that nerve interference. So when we took a second picture about a year later, she was doing fine at this time. She was very active. We went over to that same laboratory and took that same picture, and it showed that the 1/4 inch of the leg that was short before it grew to be equal to the left leg, and this is what showed up. This is the first one is the leg on the left, and the second one is when it regenerated itself. And the reason I show these to the patients is how powerful the body is to heal itself, not because we're a great chiropractor. We're just removing the interference so the body can make these corrections. All I'm trying to do here is explain the approach that medicine takes in relationship to how chiropractic approaches disease processes. This patient has a headache and indigestion, so she went to St. Vincent's Hospital. They did all the diagnosing. They said she had iron deficiency anemia. So they started to treat her for this nutritional problem, but in the meantime she started to lose control of her right arm and her right leg. Then they changed the diagnosis to MS, multiple sclerosis. Well, they were treating her for about 2.5 years, and She got disgusted with them, so then she went over to USC Medical Center. They did the diagnosing on her and said, well, you aren't suffering from iron deficiency anemia or from MS, you're suffering from cysts at the base of the brain. So this is what they did. They performed a laminectomy, which means they cut all the spinous processes off of the cervicals. And they told her they drained the cyst and put a shunt in, but it didn't show up because if they had, we would have seen where it was draining. So she didn't get any better. She didn't get any symptoms changed. She came to me about 5.5 years later. And we started to adjust her. In about a month and a half, she started to get sensation back in the right arm and the right leg. She got full use of the right arm and right leg. She lived for 10.5 years in a second-story apartment in Glendale here. Went back to USC every 6 months. And at the end of 2 years, they said, don't come back. There's nothing wrong with you. This is what I'm trying to show you from what we demonstrated. What are we doing and how does it affect the body? It shows in here the third lumbar has gone posterior where the arrow is. That affects the disc and makes it bulge as a herniation, and it can affect the nerves that are coming out at that area. And whatever nerves are being supplied by it that are interfered with, it's going to cause that organ, tissue, or cell not to function properly. So our job is to measure it, to move it, to correct it, to see that we're changing it, and take a post-X-ray. After 10 visits, we took that second picture, and it shows that that segment went back to its normal position. And that's what I want to explain, how chiropractic works. Thank you for spending the time to review this presentation so you can understand what we're trying to approach in maintaining a better condition of your health. And we'll go into detail more when we explain the x-rays, and someone will be with you in just a few minutes.